Madhumeha or diabetes mellitus. Know about symptoms, prevention, risk factor, management and treatment.
Subscribe our YouTube channel Medical Health 365 days to see medical related useful videos and press bell icon to get free updates.
Madhumeha referred to diabetes mellitus. It is a condition that causes higher blood sugar level for a person, prolonged period. Serious long-term complications can be including cardiovascular disease, chronic kidney disease, stroke, nerve damage, damage to the eyes and foot ulcers, etc. Normally, the pancreas releases insulin. It regulates blood sugar level. Diabetes is a condition characterized by the body's inability to regulate glucose, sugar, levels in the blood. This is one of the major health problems affected in our community. Classification of diabetes mellitus. 1. Primary diabetes. Type 1 diabetes, insulin-dependent diabetes mellitus, IDDM, or juvenile diabetes. Type 2 diabetes, non-insulin dependent diabetes mellitus, NIDM. 2. Secondary diabetes, pancreatitis, hormones and endocrine abnormality, Cushing syndrome, acromegaly, etc., genetic syndromes, drug-induced. Type 1 diabetes, it considers as an autoimmune disorder. Here body does not produce enough insulin. Approximately 10% of all diabetes cases are type 1. The cause is unknown. Type 1 diabetes is usually diagnosed in children and young adults, although it can appear at any age. Type 2 diabetes, body doesn't enough insulin for proper function, a condition in which cells fail to respond to insulin properly. In worldwide, approximately 90% of all cases of diabetes are of this type. It can occur at any age. Gestational diabetes, it is the third main form, and occurs when pregnant women without a history of diabetes develop high blood sugar levels. The maximum gestational diabetes can control their diabetes with exercise and diet. What are the symptoms of diabetes? Symptoms may develop rapidly, within a weeks or months, for type 1 diabetes. On other side, type 2 diabetes usually develop much more slowly than type 1. Polyuria, increased urination. Polyphagia, increased hunger. Polydipsia, increased thirst. Weight loss. The classic symptoms of untreated diabetes are: other symptoms can be feeling very tired, tooth gum disease, slower wounds healing, blurred vision, fatigue, tingling or numbness in the feet or toes, ulcer and skin itching, etc. What are the risk factors of Madhumeha or diabetes? A family history of diabetes, high blood pressure, unhealthy diet, obesity, physical inactivity, increasing age, poor oral health condition, impaired glucose tolerance, IGT, history of gestational diabetes, improper nutrition during pregnancy. How you may prevent diabetes mellitus? Maintain proper diet, avoid unhealthy food, exercise and physical activity. Maintain your proper body weight. Try to reduce your mental stress. Maintain proper lifestyle. Maintain proper oral health. Poor oral health means dental caries, gum disease, and poor oral hygiene maintenance can cause or aggravate multiple chronic disease. Proper oral health maintenance may help you to maintain proper blood glucose level. Blood test glucose level, plasma glucose test, oral glucose tolerance test, glycosylated hemoglobin or hemoglobin A1C, Fasting plasma glucose test at least 126 mg per deciliter means diabetes. Between 100 mg per deciliter and 125.99 mg per deciliter means prediabetes, and less than 100 mg per deciliter means normal. Management and treatment of diabetes mellitus. If you are a diabetic, take the doctor opinion. Don't neglect it. Visit doctor and follow the advice. Treatment of type 1 diabetes involves multiple daily injections of insulin. Many different types of medicine are available to help lower blood sugar levels in people with type 2 diabetes, commonly given orally. Sulfonylureas, biguanides, meglitinides, alpha-glucosidase inhibitors, thiazolidinediones, etc. are the available medicine. Visit doctor and follow your doctor's advice. Homeopathy medicine for diabetes. Homeopathy treatments are symptomatic. There are so many medicines used according to patient's signs and symptoms. Arg, met, acetic acid, belladonna, halaberus, lycopodium, perp, acid phos, equisetum, crijote, nat, mud, acid nit, lecithin, sulfur, iranium nit, pancreatinum, chimapimla unb, chionanthus, syzygium, ignatia, nat, sulf, urea, moschus, tincture, lower and higher potency. The biomedicine is nat, sulf, kali phos, kali mud, 6x or 12x. Medicine are useful according to symptoms. Management of diabetes. Take the healthy proper diet. Need to pay attention to some of your food choices, most notably the carbohydrates you eat. Can take fiber-rich foods. Maintain proper lifestyle, exercise, maintain oral health and maintain proper body weight, etc. Some foods can help to control diabetes and other complications. Cinnamon, leafy green broccoli, spinach, kale and beans, etc. Apple, olive oil, quinoa, oatmeal, almonds, walnuts and nuts, fatty fish and egg, cranberries, aloe vera. It is on preliminary research stages, has shown a good effect that aloe vera can help reduce cholesterol. It also helps in maintaining blood sugar.
Visit our website www.medahelp365.com. Find doctors, hospital, medical service provider information. Read article and lots more. Subscribe our YouTube channel Medical Help 365 Days to see medical videos.